Donna Smith, great to have you with us today. Let's get right to this. It's open enrollment season. For those of you in Oklahoma, though, that has nothing to do with hunting season. Just saying that because Shane's not here. I feel I got to make a shout out to Oklahoma.
And no Okie jokes?
Well, I thought that was a bad enough one. We mean health insurance, and that covers Medicare, Obamacare, PPOs, HMOs, and all of the rest. So, Donna, let's start with Medicare. What's open enrollment and when does it start?
Okay, open enrollment for Medicare is going to begin on October 15th and run all the way through December 7th. So that's for anybody who's already on Medicare and who wants to make any changes to the Medicare drug coverage, or they want to make any changes to Medigap coverage or to Medicare Advantage plan. You don't have to do anything. If you want to just stay in what you're in right now, you don't have to do a darn thing. Just leave it alone. If you want to make any changes, though, you need to do that during that period.
Okay, so you can make changes to any of your plans in that period. Now, what if you decide you want to switch your whole plan? Can you do that at that time?
Yes, you can do that, but you have to wait until that open enrollment period. You'll probably get plenty of literature in the mail. Most of us who are of the age of a Medicare age are going to get lots of ads from people who want to carry your coverage. So you'll see your mailbox start filling up with that stuff, and you can look at it and read it. But remember, it is advertising. You have to be smart enough to look at those plans and decide if it really matches what it is you need. The Medicare.gov site has a really wonderful section where you can even plug in the medications that you take and see under which plan, at which premium level, you will fare best with your pharmacy needs too.
Well, that's really important. I'm sorry to talk over you, Donna, because that is an important part, because so much when you're shopping plans, medication is a big one. So tell us again, where can you go to put in your medications and find out which plan?
Go to Medicare.gov. I do it every year with my husband's meds. I plug them in, and I always sit there and get a little crabby about how many medications I have to enter in. But he was so right. Last year, I wanted to change him to another plan, and with one of his medications alone, it would have amounted to $70 more a month for us to pay if I went with the plan that I thought was a better deal with premiums. So just make sure you take a look at it, look at what your meds are, and decide what works best for you.
That's so important. Now, you did mention Medigap. Talk about Medigap and what it is.
Okay, there's a difference between a Medigap plan, or it's also sometimes called a Medicare supplemental plan, and it is just what it sounds like. It allows you to get coverage for any of those deductibles or payments that Medicare doesn't cover. A Medicare Advantage plan is a little bit different. It's like enrolling in a PPO or an HMO that is Medicare based. So the company, it's actually through a private insurance company. They will determine where you get to go, who you get to see. A Medigap plan is not that way. A Medigap pays supplemental coverage for you, and you still get to choose wherever it is you want to go with your Medicare coverage.
That's great. So now, Donna, remind people who are just turning 64 what they need to do to enroll in Medicare.
Okay, it's also very simple, but you have the 3 months prior to your birthday month when you will turn 65, and the 3 months after your birthday month. So you have 7 months total. Now, who came up with that delightful time period? I have no idea, or for what reason. But so for me, for instance, I'm a November baby, so I would be able to start August, September, October, November, and then the 3 months afterwards to take a look. So when I'm 64, you can bet I'm going to be waiting for August to hit so I can go ahead and get on and enroll. And then you would actually, your Medicare coverage would take effect on your birthday of your 65th birthday.
That's great. So now what about fines for not having insurance under Obamacare? When is that going to kick in?
Well, that has already kicked in for people who didn't have coverage in 2014 or 2015. That in 2015, the penalty was 2% of your income, or there was a maximum of $900 per family, whichever was greater. So for some people, that can be a substantial amount of money if you didn't have insurance. Once we get into 2016, that starts to go up higher. It'll be 2.5% of your income, or the cover for a family, it'll go up to almost $1,000 for a penalty if you don't sign up for insurance. So some people are making that choice, that it's just cheaper to pay the penalty, or makes more sense to them for some reason. For me, that doesn't make sense. There's too much risk involved for me. with previous health problems and so forth, I'm not going to risk that. But there are other people who don't have health problems who make that decision. Not wise, in my opinion.
I don't think that's a wise choice either. So now, what about the Affordable Care Act? How is that doing?
It's doing all right. I mean, there are still some bumps and grinds with it, obviously. You know, there are people who are underinsured, terribly underinsured, who have gone on and decided that for whatever reason they'll sign up for one of those bronze plans or a silver plan that has deductibles and copays that are so high that they pay their premiums, but they can't afford to go to the doctor because they make a decision, I can't make that copayment or get that deductible paid. So there's still some real glitches that need fixing.
And when is the open enrollment for that?
That will begin November 1st and it'll go all the way through January 31st. So everybody they have a good amount of time to take a look at your coverage. You know, for those companies that make changes on January 1, it does allow you to take a look at what your employers are offering, what your spouse's employers are offering, and make that decision. There are families who have people who are taking their coverage from work just for the individual, and then the other family members are getting covered under the exchanges, which is acceptable if that amounts to a better deal for your family. Again, you have to be smart. If your state has an exchange, go on that exchange. Those rates are published now, what the insurance companies are going to be charging for next year. So you can go on those exchanges, take a look, start comparing what the plans offer and what works for your family.
So here in California, Donna, how would they go onto the exchange? What do they type in?
They can just type in, you can type in ACA California, it'll get you to the California exchange. So you can take a look at it. You can also Google California's exchange for the ACA, Obamacare California. There's lots of ways to find it. Or you can go to healthcare.gov and look for your state and just click there and it'll take you there. You can go to California's site and just click in. It'll ask you a few questions about what you're comfortable with in terms of premiums and so forth, a range of premiums, and then it'll gear you to take a look at what those plans are. You can even tentatively put something, at least in most of the exchanges, you can tentatively say, this is one I may want to take, so it saves it for you, so later on you can come back and take a look at it.
Okay, so we have about 3 minutes left. What else would you like to tell healthcare consumers out there? Anything about hospital billing?
Absolutely. Here's an important thing for all of us that I didn't used to do as frequently as I do it now. Asking for an itemized bill when you get healthcare services or when you're hospitalized is a critical part of being a patient in this system. It's not only important because it's just right to know whether you're getting everything that you're being billed for, but it's one way to create better transparency so we can all see what we're going to be charged for. I give an example sometimes. I had a knee replacement done 10 years ago. And I got the bill and I got an itemized bill and I took it. There was a saw blade on it that cost $700.
Wow.
So just for fun, I called up the billing office and I said, I'd like to have the blade. And they asked me,
That's great.
Well, we can't really do that. I said, well, if
You
I'm
paid
paying for the blade, and I said, it must be quite a saw blade.
For
Maybe
$700
we could use it for Thanksgiving dinner or something along those lines.
Brilliant, Donna. That is brilliant. And did they practically die on that one?
Yes. The woman started laughing and she said, quite honestly, I don't think we can give you the blade. I said, well, then I don't think you should charge me if you're going to clean it up and use it again.
Which you know they are going to clean it up and use it again.
Of course they are. Of course they are. So, just spotting those kinds of things and calling them to task. The other thing that's really interesting for people to know is that every hospital has what's called a charge master. It's a list that they maintain behind the scenes of all the charges for every little nitty-gritty thing that they provide for you. And on that charge master, it also is so interesting because it'll list the difference between what I, for instance, might pay, what you might pay with your insurance contract, what others might pay. Fascinating to take a look at those charge masters and find out that so much of what's done has little basis in reality in terms of charging. It just may happen that your insurance company was aggressively better at negotiating a price for something than another insurance company might be. And to those of us get frustrated with that, how can a saw blade cost $700 for Donna and perhaps for Casey, that saw blade's charged $200? It just is, there's nothing real about it.
And that's why I think it's so important, Donna. You bring up a good point about asking for an itemized bill, because if everybody asks for an itemized bill, don't you think it might change the outcomes of those bills a bit?
Absolutely. I mean, we joke about a $200 Tylenol or a $200
Yes.
aspirin. Sometimes we joke about those things because it seems so outrageous, but it's done all, as we know, all the way throughout the system.
Yes, it
It's
is.
done to maximize profits, to make sure, they'll tell people that they have to charge so much because of all those uninsured people that they're covering. And we all know that is just not reality. It's not true. Just the same way we often hear that the reason healthcare costs so much is those darn labor charges for all those nurses.
Boy, and I hear that way too often, so I'm
Oh, yeah.
glad if they put it off on somebody else rather than us.
Absolutely.
So Donna, it's always a pleasure. For more information on these topics, you can visit ssa.gov/Medicare/ or healthcare.gov or nursetalksite.com. Always a pleasure, Donna. Thank you so much. You know so much. You're not even working off a script or anything. This is just, you live and breathe this, and we really appreciate your knowledge.
Absolutely. Thank you all, and take care of those Okies out there.
Thank you in the Mile High State. We appreciate it.
Absolutely.